Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about Lyme disease, understanding the complexities. What is Lyme disease? It's caused by a spirochete. It's a bacterial infection caused by Borrelia burgdorferi in North America and other Borrelia species in Europe and Asia. It's a vector-borne illness. Vector-borne transmission refers to the way infectious diseases are spread from one host to another through a living organism called a vector. It's transmitted to humans through the bite of infected ticks, commonly known as deer ticks. There is an increasing trend. It was estimated that there were 496,000 new cases annually since 2010. It's a zoonotic infection. Ticks acquire the bacteria from reservoir hosts, primarily the white-footed mouse, and remain infectious throughout their life cycle. Stages of Lyme disease. Lyme disease progresses through three stages if left untreated. Early localized stage, erythema migrans rash, a characteristic bullseye rash that appears at the site of the tick bite. Malaise, arthralgia, joint pain, fatigue. Early disseminated stage, arthritis, carditis, neurological manifestations such as facial palsy. Late disseminated stage, persistent or more severe forms of arthritis and neurological issues. Diagnosing Lyme disease, not straightforward. Diagnosing Lyme disease can be challenging compared to other infectious diseases where direct detection by culture or polymerase chain reaction or PCR is more reliable. Indirect methods. Laboratory diagnosis primarily relies on serological two-tiered testing, enzyme immunoassay. Challenges. Varying sensitivities based on the stage of illness can lead to false negative results, potential for misdiagnosis, which can delay proper treatment. Direct detection via culture or PCR is mainly used in research studies. Treatment for Lyme disease, antibiotic therapy. The primary treatment for Lyme disease involves antibiotics. Common regimens: orally, doxycycline, amoxicillin, cefuroxime; intravenous therapy, ceftriaxone for more severe or disseminated cases. Timeliness is key. Antibiotic therapy is most successful in earlier stages of the illness. Delays in diagnosis and treatment increase the odds of treatment failure and chronic symptoms, such as cognitive and musculoskeletal impairment. Post-treatment Lyme disease, or PTLD. Treatment failure. A significant portion, 10 to 30% of Lyme disease patients, continue to experience symptoms even after antibiotic treatment. Definition: PTLD is defined as persistent or relapsing symptoms such as fatigue, musculoskeletal pain, and cognitive impairment for more than 6 months after completing antibiotic therapy. Prevalence: an estimated 2 million people in the United States experience PTLD in 2020. Subjective symptoms. These manifestations are often subjective and can range from mild to severely debilitating. Potential mechanisms for persistent symptoms. Several mechanisms are proposed to explain why symptoms persist after antibiotic treatment. Number one, autoimmunity. The immune system mistakenly attacks the body's own tissues. This can occur due to molecular mimicry, Borrelia antigens resembling human proteins, epitope spreading, or chronic inflammation. Strongest evidence exists for antibiotic refractory Lyme arthritis, where immune modulating drugs are effective. Two, Post-infectious immune-mediated sequelae. Damage to tissues or organs occurs during the initial infection. Even after the bacteria are cleared, the damage and ongoing inflammatory responses can cause lasting symptoms. Functional changes to mitochondrial components in tissues like the heart, nerves, and skeletal muscle are being investigated. 3. Persistent infection. A small number of Borrelia spirochetes may survive antibiotic treatment as viable, non-cultivatable, or non-viable cells. These surviving bacteria or their components may continue to elicit an immune response, contributing to persistent symptoms. Evidence from animal models suggests spirochetes or their nucleic acids can persist even after treatment. Next generation treatments and biomarkers. Research is actively exploring new approaches to address PTLD, antibiotics and pathogen-specific inhibitors, screening existing drug libraries for activity against Borrelia persistent cells, repurposing FDA-approved drugs, e.g. disulfiram, vancomycin, dapsone, developing new drug combinations effective against different Borrelia forms, investigating natural compounds and essential oils with antibacterial properties. Immune therapies, developing immunomodulatory drugs to dampen or enhance the immune response, exploring therapeutic monoclonal antibodies to target Borrelia-associated antigens or modulate host immune responses. Biomarkers, identifying diagnostic, prognostic, and treatment response markers to improve patient identification, predict outcomes, and evaluate treatment effectiveness. Research includes studying proteins in cerebrospinal fluid, gut microbiome profiles, cytokine levels, and genetic polymorphisms. Conclusions and future directions. Complex etiology. PTLD likely results from a combination of mechanisms, including persistent infection, autoimmunity, and lingering immune-mediated damage. Heterogeneity of symptoms. The diverse and complex nature of PTLD symptoms reflects the varied underlying causes. Translational research, insights from laboratory studies, in vitro, and animal models are crucial for developing better patient care strategies. Advancing patient care. The goal is to evolve definitions and guidelines for Lyme disease with ongoing research aiming for a true clinical cure for all cases and ultimately making PTLD a thing of the past through personalized medicine and innovative treatments. Well, thank you for listening to this talk. Please consider buying my new book, 100 Pathways to Longevity, and subscribing to this channel. Thank you very much.